Hello, we are the Malta Health Students Association within the Faculty of Health Sciences at university. I am Kylie Fenech, the Secretary General.
And I am Stella Sammout, the External Affairs Officer. We would like to start by asking you this question. How do you think technology has affected the Maltese health system? In this video, we will be following the patient pathway and including all the different healthcare professionals that may be involved in the treatment process of a patient.
We will be following the care pathway of our patient, Maria, a pregnant woman of 35 years. She went to her GP as she was experiencing foot ulcers that looked infected. Her doctor referred her to a number of healthcare professionals to seek help. This journey will start in the laboratories of the applied biomedical scientists, as described by Stella.
The applied biomedical scientist's job is to test Maria's blood sample. Her doctor suspected that she was suffering from diabetes, and from the blood test, the applied biomedical scientist could confirm the doctor's suspicion. The three main tests carried out by the lab in the diagnosis of diabetes are the fasting blood glucose and the glucose tolerance test. The fasting blood glucose test involves blood being taken when a patient has been fasting for at least 8 hours, and the amount of blood glucose is measured. The test is generally used for monitoring and to screen diabetes. On the other hand, the glucose tolerance test tends to be more sensitive and is used when the result for the previous test is borderline. The test measures the level of sugar during fasting and the level of sugar in the blood an amount of time after the patient ingests a sugar solution. Next in the process is the nurse. The nurse performs a check of the foot, the heels, and the area between the toes, and looks for any signs of redness, breaks in the skin, inflammation, or swelling. Maria is encouraged to look after her feet and inspect them daily to notice any changes. The nurse informs the patient that appropriate footwear must be chosen, as a wrong size or style can lead to foot deformity, calluses, and even ulcer formation. Due to the fact that the diabetic patient may suffer from sensory loss and may not feel the injury until it's too late. The nurse plays a key part in the management of diabetic foot, as they have the knowledge to distinguish the different types of ulcers as well as the appropriate dressing required. Wound dressing is very important as it keeps the wound clean and retains the appropriate wound moisture, helping to contain the bacterial infection. The radiographer's role is to obtain a good diagnostic image of the affected foot while delivering the least dose possible to the patient. The radiographer must follow strict imaging protocols to obtain the required images. Therefore, patient cooperation is vital in this process. The main reason an X-ray is taken is to understand and recognize the signs of acute or chronic osteomyelitis, which is characterized by inflammation and destruction of the bone. This will reduce the chance of late or missed diagnosis and result in more timely and effective treatment of the patient. When imaging the foot, two projections are obtained, the anteroposterior and the oblique view. The podiatrist would conduct a diabetic foot assessment. The first step would be to ask about the state of the patient's diabetes and how it is controlled, along with obtaining the appropriate patient history once this is done. The podiatrist would use a Doppler to check for nerve impulses in the foot as part of the vascular assessment. The next step would be to check the sensation of the foot using a monofilament, where 10 points on the foot would be checked. Lack of sensation would indicate signs of peripheral neuropathy. After all this is done, Maria would be categorized into a high-risk or low-risk category, and the podiatrist would decide if the patient would need referral or not. I would now like to invite Kylie on stage to continue Maria's treatment pathway.
The physiotherapist is involved in promoting physical activity. In Maria's case, it is ensured that exercises are carried out on both legs due to the decreased surface area because of the ulcers, therefore decreasing the pressure and risk of ulcers. They provide the patient with heel or toe offloaders, which helps her practice gait by loading the toes rather than the heels. Since Maria is also pregnant, the physiotherapist can also carry out a gait assessment. This is because during pregnancy, women walk in lateral rotation, causing them to waddle, so it is easier for Maria to injure her foot. The midwife provides dietary information for Maria to follow throughout her pregnancy. If Maria doesn't control her sugar intake, this may lead to complications, both for her and her child. Showing the mother the importance of good blood glucose control throughout pregnancy will reduce the risk of fetal macrosomia, trauma during birth, induction of labor or cesarean section, preterm birth, neonatal hypoglycemia, and perinatal mortality. Since Maria also experienced postnatal depression after she gave birth, she may exhibit lack of appetite or overeating, feeling fatigued, and avoiding social situations. If these symptoms take longer than 2 weeks to resolve, it is advisable to seek professional help, whereby the midwife can refer her to the perinatal mental health midwife. Later on in life, Maria's son was diagnosed with autism by a psychologist. He was referred to a communication therapist and an occupational therapist. Communication therapists are involved in helping the child overcome speech and communication problems that he may be experiencing due to his autism. The process of communication therapist consists of 4 main steps. These are sorting, matching, comprehension, and expression. For sorting and matching, various puzzle games are used to encourage object-to-object matching, color sorting, object-to-picture matching, and picture-to-picture matching. Once these tasks are achieved, comprehension and expression of verbs, nouns, and adjectives occurs. The occupational therapist first carries out an initial assessment to discover problem areas on which the treatment plan may be based upon. An occupational therapist works to develop skills for handwriting, fine motor skills, and daily living skills. Fine motor skills activities include Play-Doh, puzzles, drawing books, and stacking small objects, such as blocks. However, the most essential role is also to assess and target the child's sensory processing disorders. Various assessments may also be done regarding this. When a child experiences hyperreactivity to sensory input, it can cause the child to be in a state of high alert much of the time. When the nervous system is in a state of high alert, attention is difficult, and the child's frustration tolerance tends to be lower. On the contrary, if a child does not receive the sensory input the body needs, they may seek out that input through behaviors that interfere with treatment or classroom instruction. In the end, Maria and her child received all the necessary care for them to be able to improve their conditions in the best way possible, from all the perspectives of the healthcare professionals taking care of them. Although it may not always meet the eye, each healthcare professional mentioned plays a key role in patients' care, and thus we all empower patients in a unique way as part of our different professions.